My name is Roy Cardwell. I'm a pharmacist here at the hospital, and I manage the anticoagulation clinic, which is also associated with the hospital. And we treat patients who are at risk of blood clots or who have a history of blood clots. And today I'm going to talk a little bit about Lovenox, or enoxaparin, which is the generic name for the drug. And you've been prescribed Lovenox as a medication once you're discharged from here in order to either prevent blood clots or treat blood clots that you already have. So Lovenox comes as a pre-filled syringe, which you'll be able to get from your outpatient pharmacy once you leave the hospital. The syringes look like this. They say enoxaparin sodium on them, and they also have a air bubble in them, and that air bubble is supposed to be there, so don't go and try to expel the air bubble. That's fine if you inject the air bubble when you're injecting the medication. So prior to your injection, you want to make sure that your hands are clean, so you wash your hands beforehand. So for the purposes of this video, just imagine that I have cleaned my hands. And the injection site you want to choose is 2 inches to the right or to the left of your belly button. So just think love handles. So my belly button's right here. My injection site's going to be here. That's about 2 inches over. In order to get the site ready for the injection, you want to make sure that you use an alcohol pad, which comes in a little packet like this, and it's just a little alcohol wipe, and you clean the area off well and let that dry. And once that's dry, you take the syringe, which I showed you earlier, it looks like this, and you take the cap off. Just pull it straight off like that. Once you pull it off, it's ready to inject the medication. Don't expel any of the medication unless you're told to, and once again, don't get rid of the air bubble. Before you inject it, pinch a little bit of the skin up like this. So imagine that this is my skin, and go hold the syringe like a pencil or a pen, and just go straight in at a 90-degree angle into the skin. And once it's in there, push the plunger all the way in until it stops, and then pull the syringe out the same angle that you put it in, so straight out. And once it's out of the skin, you can it comes as a little guard, so point the syringe away from you and then push the plunger in a little bit more, and a guard will come out to protect the needle from sticking you or someone else. And then once that's done, you should have a sharps container, and you can put the syringe into that sharps container. And once the sharps container is full, or you're done with your Lovenox injections, you can either take it to your doctor's office or to the hospital, and they can dispose of it for you.